Active listening. Active listening is a skill that can be acquired and developed with practice. However, active listening can be difficult to master, and, therefore, will take time and practice to develop. Active listening means, as its name suggests, actively listening to another person, fully concentrating on what message is being said rather than just passively hearing the message of the speaker. It involves listening with all senses, giving full attention to the speaker, and it is important that the active listener is also seen to be listening. Otherwise, the person speaking may conclude that what they're talking about is uninteresting to the listener. Interest can be conveyed to the speaker by verbal and nonverbal messages, such as maintaining eye contact, nodding your head and smiling, agreeing by saying yes or mm-hmm, and encouraging them to continue. Providing feedback regularly through the conversation will allow the person to know that they are being heard and understood, and they'll feel more at ease and communicate more openly and honestly. Active listening is the most fundamental component of interpersonal communication skills, and it is the very foundation of counseling and case management. Listening is not something that just happens, even though it's something that we do every day. Listening is an active process in which a conscious decision is made to listen and to understand the message of the speaker. So the primary purpose of listening is allowing the helper to understand the world and problems of the client. Listeners should remain neutral and non-judgmental, trying not to take sides or form opinions, especially early on in the conversation whenever we're trying to build respect, we're trying to show respect and build trust. Listeners should avoid jumping in with questions or comments every time there's a few seconds of silence. Active listening is also about patience. Pauses and short periods of silence should be anticipated, and the listener shouldn't feel as though they have to fill that silence with anything. Finally, active listening involves giving the other person time to explore their thoughts and feelings, and so they should be given ample time for that and attention so that we truly understand their concerns. There is a difference in listening to respond versus to understand. We listen to a lot of people day in and day out. However, we haven't been taught to listen in a very skillful way. So typically, we listen for what we need to hear in order to respond efficiently and effectively to the speaker. In a counseling role, we need to mold our skill set in order to listen to understand, not just listen to respond. Listening to understand means that we're giving the client our full attention, and we are incorporating the 5 aspects of listening, which are our ears to hear, eyes to see the client and connect, the heart to be empathetic and feel the story that they're telling, the mind to think and process what is being said, and undivided attention in order to truly focus and respect the speaker. Active means that it's a process and we need to be invested and involved in it. We can't be passive and laid back. Listening doesn't just happen. Active listening involves being attentive to both verbal and nonverbal behaviors of the client. So in order to hear the person and the whole message that they're sending, we can't just listen to the words that are being said. We need to also look at the body language that they are exhibiting. Are the statements, the message that is being sent, are they congruent in the verbal and nonverbal behavior? For example, say a client expresses that they are truly at ease in talking with you and they feel like they can share anything, but their arms are crossed really tightly, they're shaking their leg and avoiding eye contact. This may be some indication that what they're saying and how they actually feel might not be congruent. We don't know this for sure, but it does give us a sign. And in order to find out if these messages are incongruent, we would need to bring it up and ask the client about it. I hear you saying that you're really at ease, but I'm noticing that you still look uncomfortable as you're sitting in the office here. I see your legs shaking and you really aren't making very much eye contact. And then just use the silence to draw them in and respond to that. You're making a very gentle observation about something that seems a little incongruent, but not really making any judgment about it. So, listening seems easy enough, right? We do it all the time anyway. But we haven't truly been trained to actively listen and respond in a therapeutic way. Learning how to be a better active listener will change not only your professional skill set, but can have a large impact on your personal life and social life with friends and family and those who are close to you. By being a more active listener, you also encourage others through example how to be better listeners. There are challenges to listening. We can be distracted by things that are going on in our life or something that we have on our mind. We can maybe not understand our clients in a clear way because they're not able to express themselves really clearly. Sometimes clients come to us and they don't really have a clear understanding of what the problem is yet, and so it's hard for them to articulate that when they themselves don't even know. Our reality filters affect perception, so we have a unique worldview and the client has a unique worldview, and sometimes if we don't check our perceptions, then we can be interpreting things in a way that is not the way the client intended it to be perceived. Also, humans can mentally process faster than they can speak. And this contributes to listening in order to respond, because our brain has already processed the information and has come up with another question that we want to ask, instead of listening to the rest of the message that is coming from the speaker. So our brain goes a lot faster than our verbal process, and that can cause us to want to interject. We can also be stuck dwelling on something that was said, and our brains can get stuck on that, and then we're not able to continue to listen to what's being said. Overall, this is just a skill that we need to work on and practice. No matter how much training or education that you have around this topic, we can all still become better listeners. It takes practice in not just your professional life, but in everyday conversations. Good listening is almost like an art form. Americans in general tend to value talking and expressing ourselves more than listening. But as helpers, human service professionals, we need to take a step back and evaluate our listening skills. We need to put the client first, and we need to convey respect and build a sense of trust with our clients. Being listened to and understood is so important to the helping process and is critical to healthy relationships. Human service professionals become good listeners through training, practice, and experience.